Hi everyone, welcome back to the monthly movement tip with RX Physical Therapy. I'm Dr. Alex and this is Dr. Charles, and we're going to bring you through a few exercises to help with your wrist mobility to help you better in the gym.
First thing we're going to do is use a lacrosse ball to help loosen up the soft tissue on the front side of your forearm. This way your wrist has an easier time bending into a front rack position. So Alex is going to have the lacrosse ball on her arm, so she's going to rest on it and she's going to kind of roll out. She's going to see if she feels any sore or sticky spots that are limiting her range or just feel a little bit uncomfortable. If she finds one, she can kind of work it out a little bit. If she's looking to supercharge that and get a little bit more out of this, we can take a medicine ball. We'll rest it on top of her forearm. This way the weight of the ball pushes down a little bit harder. Once she finds some of those sticky spots, she can hang out for about 30 seconds on each of them with the weight of the ball so that the muscles can loosen up and she has an easier time getting into wrist extension.
Okay everyone, our second drill for today is going to be a banded mobilization for your wrist with this band. So what I'm going to have Charles do is put his hand through the band here, and he's going to place his hand directly on the box. You want to make sure your elbow stays straight and the band is just around the crease of your wrist here. And what he's going to do is rock forward and bring that wrist into extension, hold it for a few seconds and rock back. You can do about 10 to 15 rocks, holding it 3 to 5 seconds at that end range position, and then switch sides.
The last thing we're going to do is a finger lift off and a prayer stretch. So Alex is going to have her hands together. She's going to keep the heel of her hand and the knuckles of her hand together the whole time. She's going to drop her wrists down so that they're in line with her elbows. Keeping her hands together, she's going to try and separate her fingers and hold for a 3, 2, 1 count. When she does this part of her forearm is going to light up. A lot of times what you'll see in people is when they go to separate their fingers, their hands will lift and their elbows will drop. If you can't maintain a position with your elbows in line with your wrists while you're doing this, you can just start in a position where you're set up with your elbows a little bit lower than your wrists so that you can be successful. The more times you do this, the more into the stretch that you can get as you go. So I would do this for 10 lift-offs for a 3-second hold before you grab your barbell.
Well, there you have it. That's our monthly movement tip from RX Physical Therapy to help with your wrist mobility before getting ready to lift up the barbell. If you want more, you can look at our YouTube and look at our archive to find more monthly movement tips, and we'll see you next month.